Welcome to the recorded version of Managing COPD at Home, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care. Our presenter today is Lakeland Hogan. Lakeland is a gerontologist and caregiver advocate for Home Instead Senior Care. She works to educate professionals, families, and communities on issues older adults face. Lakeland is a doctoral candidate at the University of Nebraska, Omaha, where she is studying social gerontology. She has a Master of Arts in Social Gerontology and Master's in Business Administration from UNO. Lakeland has professional experience in the private and public sectors of senior care services. She has worked on special projects for UNO's Department of Gerontology and the local area agency on aging. Lakeland serves as Vice President of the Board of Directors for the Dreamweaver Foundation and is active in the Alzheimer's Association's Walk to End Alzheimer's. Lakeland has a passion for helping others, especially aging adults and their families. And with that, I would like to turn the presentation over to Lakeland Hogan. Thanks for being here today, Lakeland.
Thank you so much, Steve. Hello, everyone. I hope your Wednesday's off to a great start. Thank you so much for joining us today for a topic that's fairly common among the older adults that we work with, and that's chronic obstructive pulmonary disease, or more commonly referred to as COPD. And this disease can have its challenges, so hopefully I can provide you with some resources and tips to pass along to the families that you work with to help them better understand and better manage this chronic disease. And before we get started, I just wanted to do a brief introduction to COPD on this next slide here. So to put this kind of into perspective, I wanted to give you a few statistics on COPD. It's one of the most common lung diseases and a condition that impacts the senior's ability to breathe. And according to the National Heart, Lung, and Blood Institute, COPD is the third leading cause of death in the U.S. And according to the Mayo Clinic, COPD is caused by long-term exposure to irritating gases or particulate matter, often from cigarette smoke, which I'm sure is no surprise to many of us. So COPD can certainly be a scary chronic condition for families and the person with the disease. Whenever breathing is affected, anxiety levels are often elevated. So as we go throughout today, we're going to talk about COPD as the disease itself and then talk through how we can help families and individuals and family caregivers manage this disease. So I want to start by showing you our objectives for today's presentation. What we'll cover today is we're going to go over the common symptoms of COPD and also talk about the possible complications that might result, and then also discover treatment options that are available, both medically and ways that individuals and families can manage this disease at home. And then we'll also end with resources and additional tips, as I always like to do at the end of our webinar today. So I want to start out by diving a little deeper into what COPD is on the next slide. I find it helpful to really understand what happens to the lungs so that we can help families understand it in a simplistic manner. According to the Mayo Clinic, COPD affects the lungs as follows. Air travels down your windpipe or your trachea into the lungs through two large tubes. And inside these tubes divide into many times, like branches of a tree. At the end of these branches then are tiny air sacs. The air sacs have very thin walls full of tiny blood vessels or capillaries. The oxygen in the air that you inhale passes through the blood vessels and enters your bloodstream. At the same time, carbon dioxide is exhaled. The lungs rely on natural elasticity of the bronchial tubes and air sacs to force the air out of the body. The lungs rely on natural elasticity of the bronchial tubes and the air sacs to force air out of the body. COPD can cause bronchial tubes to lose the natural elasticity and partially collapse. It can also cause the walls between the air sacs to be destroyed. This affects the walls of the airways and they become thick and inflamed. When this happens, the airways make more mucus than usual, which can clog the airway and make the lungs function at a lower level. Generally, lung damage caused by COPD cannot be reversed. There are treatments that may help to control symptoms and potentially minimize future damage. Generally, common symptoms of COPD do not appear until after there's already been significant lung damage. This might be one of the reasons why people still smoke, because they hear about the risks, but they might not feel the symptoms until it's too late and the damage is already done. In other bad news, unfortunately, the symptoms seem to worsen over time. So when we talk about COPD, it's an umbrella term used to diagnose people with emphysema, chronic bronchitis, and sometimes asthma. And we'll talk more about these three conditions here in a little bit. The changes in the body that cause shortness of breath are similar between COPD and asthma. Airways often become swollen and filled with mucus, but asthma is usually a result of an environmental factor. So as we look at COPD as a whole, it really comes down to damage that's caused to the lungs over time. Let's take a closer look at, I know I mentioned the statistic earlier about how COPD is the third leading cause of death in the U.S., but let's take a closer look at how that breaks down state by state on the next slide. According to the American Lung Association, more than 11 million people have been diagnosed with COPD, but millions more have the disease without even knowing it. So again, wanted to show you a breakdown of the prevalence of COPD in adults by state. So take a quick moment to find your state here on this map and see how it compares to the other states. So the darker red states and the maroon states are the ones with the highest percentage of people living with COPD, and the light yellow has the lowest percentages. So as you can see here on the map, West Virginia, Kentucky, Tennessee, and Alabama seem to have the highest percentage of people with COPD. So if you reside in those states and you work with clients, patients, families in those areas, you may be more likely to see individuals living with COPD. So as we move to the next slide, I want us to get a better understanding of the different symptoms and how we can help families be more in tune to these symptoms. As I referenced earlier, many people don't recognize the symptoms of COPD until the later stages of the disease. Sometimes people think that they are short of breath or less able to go about their normal activities because they're just getting older. But shortness of breath is never normal. If someone is experiencing any of these symptoms, or you think they might be at risk for COPD, it's important to discuss this with their doctor. Some of the symptoms of COPD might include shortness of breath, and this one is really scary for families to encounter. And we all know that when a person is short of breath, it's likely to increase their anxiety and lead to panic in a person, which can also accelerate this attack or shortness of breath. When this happens, we want to encourage families to make sure that the person is sitting upright or up against them sitting up. Have them lean slightly forward with their hands or elbows on their knees. It might help to also gently and slowly rub the person's back all the way up to the neckline. And have the family encourage the person to breathe through their nose and out through their mouth. It's important for the caregiver also to remain calm in the situation to in turn help the individual stay calm and prevent those accelerated levels of anxiety. Other symptoms that we can help families be on the lookout for is a persistent cough. Also, coughing that produces white, clear, yellow, or greenish mucus. Wheezing, chest tightness, a lack of energy, blue lips or fingernails. And then there's also a few more I don't have listed up here, but if somebody has to clear their throat first thing in the morning and it becomes something consistent, If they're having to clear their throat of excess mucus in the lungs, that might be a sign. Frequent respiratory infections and unintended weight loss, especially when it comes to that later stage of COPD, and even swelling in ankles, feet, or legs can be a symptom of COPD. So it's important for families to understand these symptoms, and it can be helpful to track these symptoms in a journal or some sort of tracking system. This will help to better understand flare-ups and triggers, and writing these things down can also help track the progression of the symptoms and recognize changes. And all of these notes can provide the doctor with more information and insight into the person's journey with COPD. So now that we've outlined the symptoms, let's talk about how COPD can be diagnosed. When it comes to a diagnosis of COPD, it's commonly misdiagnosed. Former smokers might sometimes be told that they have COPD, when in reality they might have another less common lung condition. There may also not be a COPD diagnosis until the disease has advanced and interventions are less effective. And to diagnose COPD, a doctor will review the individual's signs and symptoms. They'll discuss family and medical history and discuss any exposures to lung irritants, especially cigarette smoke. And a doctor might order several tests to diagnose the condition, including the ones shown here on the slide. So the first test is a lung function test, and this measures how much air a person can breathe in and out, and how fast they can breathe air in and out, and how well the lungs delivers the oxygen to their blood. The most common lung function test is a spirometry. During this painless test, a technician will ask the person to take in a deep breath and then blow out as hard as they can into a tube that's connected to a smaller device. This test measures how much air the person breathes out, along with how fast the person can blow air in and out. And it also can detect COPD before symptoms develop. Chest x-rays and CT scans can also show signs of COPD and may be ordered by a physician. And finally, aerial blood gas tests measure oxygen in the blood and can indicate a person's need for oxygen. So now that we've outlined how COPD is commonly diagnosed, there are some common conditions that make up COPD. So let's look at those on the next slide. COPD primarily refers to two conditions that compromise a person's breathing. They are emphysema and chronic bronchitis. Emphysema is a disease that destroys the walls and elastic fibers of the air cells in the lungs. In addition, the airflow from the lungs is impaired due to small airways that collapse when exhaling. It develops very gradually so that people don't often realize that they have it or ignore that little cough or changes in breathing. Chronic bronchitis is a condition that inflames the bronchial tubes. At the same time, the lungs may produce more mucus, which can further block the inflamed tubes. A chronic cough can develop while trying to clear the airways. So those are two very common conditions of COPD. And then people will sometimes ask about asthma, and I mentioned that a little bit earlier. So where does asthma fit into the lung conditions? Well, I mentioned earlier that COPD is that umbrella term used to diagnose people with emphysema and chronic bronchitis. And the changes in the body that cause shortness of breath are similar between COPD and asthma. The airways become swollen and filled with mucus. But with asthma, this occurs because of a factor of the environment. It could be pet dander, smoke, dust, or a variety of other things. The other difference between asthma and COPD is the age of when the symptoms most commonly develop. Asthma is diagnosed typically in childhood, and COPD is diagnosed typically in those 40 years of age and older. One major contributor to a diagnosis in later life is because, for many, years of smoking or exposure to irritants can cause slow progression of the disease. and therefore resulting in a diagnosis later in life. And although it's uncommon, some people who have asthma can develop COPD. Asthma is a chronic condition, and treatment usually can reverse the inflammation and narrowing. However, if untreated, COPD can develop. So let's talk a little bit more about emphysema here on the next slide. I mentioned earlier that in emphysema, the disease destroys the walls and elastic fibers of the air sacs in the lungs. In addition, airflow from the lungs is impaired due to the small airways that collapse when exhaling. And sometimes when talking with families, this can be a complicated disease to explain. So I wanted to provide an analogy that might be helpful when you are talking with the families that you work with and individuals affected by the disease. So you could explain emphysema as follows. A person's lungs are made up of air sac clusters that are similar to a bunch of grapes. In emphysema, the inner walls of the air sacs, or the grapes, weaken and eventually rupture, creating one large airspace instead of many small ones. This reduces the surface area of the lungs and in turn limits the amount of oxygen that reaches the bloodstream. When a person exhales, the damaged air sacs don't work properly and old air becomes trapped, leaving no room for fresh oxygen-rich air to enter. And it's also important to explain while talking about emphysema is that treatment may slow the progression but cannot reverse damage. Now let's talk a little bit more in depth about chronic bronchitis on the next slide. Chronic bronchitis, again, is that condition that causes inflammation in the bronchial tubes. At the same time, the lungs might produce more mucus, which can further block the inflamed tubes. When the airways are inflamed or infected, less air is able to flow to and from the lungs, resulting in a chronic cough. So if we refer back to the example of that cluster of grapes, the stems in the grape clusters are like the bronchial tubes. And with chronic bronchitis, those stems or tubes can become inflamed, allowing less air through, and they can even collapse. So that's, again, a good analogy to use when talking about chronic bronchitis. And people often ignore the signs of chronic bronchitis until it's advanced because they mistakenly believe that the disease is not life-threatening. But if a person waits to seek treatment, the lungs may have already been seriously injured. And this can put the person at risk of developing serious respiratory problems or even heart failure. That's why it's so important for families to understand the symptoms and document them and communicate them to their physician. The good news is that chronic bronchitis can be found early, and there is much that can be done to treat and help manage the disease. But before we look at treatment, it's important for families to also understand potential complications of COPD. So let's go over those on the next slide. The first complication is the potential for respiratory infections. People with COPD can be more susceptible to sickness such as colds, flu, and pneumonia. Because of this, there might be increased difficulty breathing or damage to the lung tissue from any respiratory infections an individual with COPD might contract. Another complication is high blood pressure. COPD may cause pulmonary hypertension or high blood pressure in the arteries that bring the blood to the lungs. A doctor would need to monitor these levels and use oxygen therapy in order to lower this form of hypertension. And things such as high blood pressure can cause heart problems. That's another complication of COPD. It might increase the risk of heart disease, including heart attacks. So if you're unable to get enough oxygen to your heart is having to work so much harder. So again, putting the person at risk of heart problems. And when a person has difficulty breathing, they may also not want to engage in healthy habits such as regular exercise because breathing might be difficult during physical activity. Lung cancer is another complication. Generally, individuals who smoke and also have chronic bronchitis may have a greater risk of developing lung cancer than smokers without chronic bronchitis. Another complication of COPD is depression. A person may develop depression because they're not able to fully partake in activities that they were once able to enjoy, most of the time due to this difficulty in breathing. They may be experiencing extra exhaustion, fatigue. They might also have difficulty coping with the fact that they now have to take an oxygen tank or other breathing devices out with them in public. And then the last complication that can occur is exacerbations. A person may experience times when symptoms are worse. It could be for days or for weeks. And again, this is known as exacerbations. They might stem from a lung infection caused by a virus or bacteria, such as a cold or some other illness, or it might be due to exposures of pollutants that can also bring on or cause sudden worsening of symptoms. An exacerbation, if untreated, could lead to lung failure. So this is a critical complication that families need to be aware of. So they need to understand what happens and how to respond during one of these exacerbations or flare-ups. So when this occurs, the lungs suddenly produce more mucus or the airways get narrower, which of course reduces the airflow to the lungs, making it harder to breathe and the cough worse. Medications or inhalers can help relax the bronchial tubes, which can help the person breathe better. But if these don't work, the family may need to make a trip to the ER. So now that we understand the potential complications of COPD, let's look at treatment options to consider here on the next slide. The goals of treatment are really to relieve the symptoms and slow the progression of COPD. So COPD can be treated with medication, as I've mentioned, both oral medications and inhalers. The goal of these medications is to relax the muscles around the airways, which help to open them up and therefore making it easier to breathe. Another important step in COPD treatment is to cease smoking. So if someone is currently a smoker and has a COPD diagnosis or showing symptoms of COPD, it's really important for them to stop smoking. And according to the Mayo Clinic, it's the only way to keep COPD from worsening. A doctor may also prescribe lung therapies, such as oxygen therapy, and that might be through the use of an oxygen mask or nasal prong, and pulmonary rehabilitation programs. This can include strategies to manage the disease, exercise and nutrition programs, and psychological counseling. And finally, surgery may be an option for people with some forms of severe emphysema who are not finding relief with the medications alone, but that is typically the last resort. And of course, the individual should consult their physician to determine which treatment is best for them. And oftentimes, people will see a specialist, a pulmonology specialist, to consult on their COPD condition. In addition to medication treatments, there are some other ways of managing COPD that individuals and families can engage in. So let's look at those on the next slide. When managing COPD, the following are important categories to consider: protecting the lungs, physical activity, nutrition, and coping with the emotions. And we'll dive deeper into each of these different categories, starting with ways to protect the lungs on this next slide. The lungs are different from most of the other organs in our body because their delicate tissues are directly connected to the outside environment. Anything that you breathe in can affect your lungs. And since the lungs of people who have COPD are already compromised, reducing exposure to anything that could make their COPD worse or cause a flare-up is really important. As we talked about earlier, the first step in protecting the lungs is to stop smoking. If the individual is a smoker, there are many ways to get help with quitting. A doctor can recommend products and medicines that can help people stop or quit smoking. And there are also some other helpful tips, such as joining a class or a support network, asking some friends and family to also support them in their effort to stop smoking. Another important way to protect the lungs is to avoid secondhand smoke. Have the individual ask others around them, possibly their family, friends, to help them manage their COPD by not smoking in the home or nearby. And the individual should avoid areas where they know smoking commonly takes place. It's also important for them to monitor air quality. Try to avoid dust and fumes. Stay indoors on bad air days, especially in larger cities that have a lot of pollutants in the air. You can check daily air quality levels and air pollution forecasts in the area. Sources for that include local radio, television, weather reports, newspapers, and even online. And then it's also important to avoid contaminants. Again, that dust, secondhand smoke, and pest sprays. And one that people often don't think about is to avoid large crowds, especially during the months of cold and flu season. And this is really to reduce the risk of contracting respiratory infections. So whatever precautions you would take to avoid contracting the flu, that would be very important for an individual with COPD to consider, including getting a flu shot. And earlier we discussed, again, those respiratory infections that can cause complications of COPD. And by receiving an annual flu shot vaccination and other vaccinations that protect against respiratory infections like pneumonia, can help reduce a person's risk of respiratory infections. So we need to encourage these individuals and their family members to consult their physicians about regular vaccinations. Because when you think about it, a lot of times healthy adults get a vaccine to protect themselves from contracting it from their children who might be in a daycare setting or grandchildren, and also older adults in general are a little more susceptible to getting these types of colds and flus. So it's really a great practice for the entire family to get vaccinated if possible, but of course consult a physician before doing so. Next, we're going to talk about how physical activity can help. Regular physical activity can actually strengthen your respiratory muscles, improve your breathing, and your overall strength and endurance. Encouraging families to go for short walks, even taking their loved one with COPD out and about, can really help get them moving. And some might feel like exercise isn't safe or even possible for a person with COPD. But the right amount of exercise and the type of exercise may have its benefits. And of course, it's important to consult the physician before making changes to these exercise routines. But moderate exercise can really improve lung function, including it could reduce the use of oxygen, increase levels of energy, and decrease anxiety levels. It can help monitor stress and depression. It can help with sleep and self-esteem. Of course, cardio fitness is a benefit, muscle strength, and also can help with the shortness of breath. And recently I was talking with a woman. There is a local gym, if you want to call it that, or fitness center that really caters to the 55-plus older demographic in my community, and they have a class specific to COPD. The class meets for 30 minutes 3 days a week, and this caregiver said that her mom, who has COPD, on oxygen all the time, engaged in this class, and she was amazed by the improvements she saw in her mom. She was able to reduce her oxygen use and had more energy. And when I say low-impact exercises, they were very low-impact. Chair exercises, simply moving arms and legs, standing up and down, but this was more than she was doing before. So she was able to breathe better and she was happier. So it goes to show that a little bit of physical activity can really go a long way with someone with COPD. So if there is a program in the community that focuses on COPD or caters to an older population or older demographic, that might be a good resource for an individual with COPD. And also, there are some great online resources. I'm going to share those with you at the end of today's webinar. When we think about physical activity, what usually goes hand in hand with that? Well, of course, nutrition does. So let's talk more about the nutrition aspect on the next slide. Metabolism is the way our bodies process the change of food to fuel. Oxygen and food are the raw materials of the process, and energy and carbon dioxide are the finished products. Carbon dioxide is a waste product that we exhale. Metabolism of carbohydrates produces the most carbon dioxide for the amount of oxygen that's used, and the metabolism of fat produces the least. For some people with COPD, eating a diet with fewer carbohydrates and more fats can help them breathe easier. Most people are surprised to learn that the food that they eat might be affecting their breathing, but the right mix of nutrients in a diet can really help a person breathe better. And it can be beneficial for an individual with COPD to meet with a registered dietitian or nutritionist. And based on the information I just shared, this slide shows some quick tips on nutrition for those living with COPD. So when looking at carbohydrates, they should look towards complex carbohydrates such as whole grains, bread, a whole grain bread and pasta, fresh fruits and vegetables. And they should limit those more simple carbohydrates, including table sugar, candy, cakes, soft drinks. They should also look at eating fiber each day. It's recommended that they eat between 20 and 30 grams of fiber, and these could include things such as bread, pasta, nuts, seeds, fruits, and vegetables. It's important for them to also eat a good source of protein. As we just talked about, protein metabolizes easier, or it makes it easier for an individual with COPD to breathe. So getting those good sources of protein at least twice a day can help maintain strong respiratory muscles and also help with energy levels. So good choices include milk, eggs, cheese, meats, fish, poultry, nuts, dried beans, or even peas. And then when looking at fats, it's important to choose mono and polyunsaturated fats, which do not contain cholesterol. These are fats that are often more liquid at room temperature and come from plant sources such as canola, sunflower, corn oils, and limit those that contain trans fats and saturated fats. For example, butter, lard, fat, meat, or skin that's found on meat, hydrogenated vegetable oils, shortenings, fried foods, those types of things. So those, again, are just some quick nutrition tips for someone living with COPD. And another way to manage COPD is to cope with the emotions. So let's look at that on the next slide. COPD can be a challenging disease that sometimes stirs up some difficult emotions. Those coping with COPD may feel depressed, sad, anxious, especially as it relates to their shortness of breath. They might be angry that they have this disease. They might be grief-ridden. They might also be regretful of maybe a past choice to smoke. They might also feel guilty. So all of these emotions are completely normal, and they don't have to take over an individual's life. There are definitely ways that we can encourage them to manage their emotions. And the first is simply calling on the support system around them, even if it's just one person. Talking with friends and family, maintaining some regular social contact can really make these challenging times easier. They could even join a COPD-specific support group that can provide additional resources and encouragement, and especially from those that are also experiencing the symptoms and challenges of COPD. And then they also need to ask for help when needed. Most people want help, but they don't know how to ask or who to ask. So we need to let the individual living with COPD know that they should not be afraid to ask friends, family, their care team, and those around them to help during tough times. It's also important for them to manage their stress. And as I've been mentioning throughout this presentation, having this disease, especially the shortness of breath, can be stressful. So having stress relief activities such as reading, listening to soothing music, napping, even exercise can be important to a person with COPD. Another way that they could cope with their emotions and manage their stress is through journaling. It might sound very basic, but just writing their feelings and emotions down in a daily journal or diary can help the individual express their feelings. They can also talk to their doctor and discuss how they're feeling. The physician might provide coping techniques or breathing exercises that can help. They may even recommend that they speak with a mental health professional such as a counselor or psychiatrist. And they might also recommend, if the person is having trouble dealing with the emotions and if they're having lots of pain as a result of their COPD diagnosis, that they connect with a palliative care team to help better manage the symptoms. And then finally, exercise can help to clear the mind and lighten the person's mood, which helps to cope with emotions. And I know we've been talking a lot about the person living with COPD, but it can also be a stressful condition for the family caregiver to assist in managing. So let's look at ways we can encourage them to manage their stress well on the next slide. A danger of caregiving, whether the person is a spouse or a grown child caring for a parent, is often making sure that their own physical and emotional well-being is taken care of. We all know that family caregivers are no help to others if they themselves are burnt out. So there are a few tips to share with family caregivers to help them manage their stress and fatigue. And some of these are in line with what I just talked about in regards to the individual coping. But taking time to exercise is the first. And exercise is not only essential to maintain the physical stamina required for caregiving, but it also can provide a break in the day and a release of emotions and stress. Caregivers should also ask for help when needed. Encourage these family caregivers to reach out with caregiving duties and ask for specific help instead of more general help. So asking somebody to come over and be with the individual with COPD for a certain amount of time so they can get away for respite. It's important to be specific in those asks. And then check with the employer that the caregiver is with to see if they have any benefits that might help in the caregiving journey. And one that I accidentally skipped over was to make sure that the caregiver themselves is keeping up with medical appointments, especially if the COPD was a result of smoking. The caregiver, if they were a child or a spouse, they could have been exposed to that secondhand smoke over time. So they themselves want to be aware of their own symptoms and their own medical needs, because so often, unfortunately, we see caregivers making sure that their loved one gets to all of their medical appointments but fail to take care of their own appointments. And sometimes they end up sick or in the hospital, or unfortunately in very tragic situations, the caregiver will pass before the individual that they're caring for if they are not keeping up with their own medical needs. So that is an extremely important one. And we also want to encourage them to monitor their spirits and to stay social. It's not unusual for these caregivers to become depressed, stressed, exhausted from seeing their loved one in pain and from engaging in those day-to-day activities. And sometimes it can be isolating. So we want to make sure that we're encouraging these family caregivers to engage socially outside of their caregiving interactions, going out to eat with friends or having family dinners, taking time to even get out to a park and just be around other people and engage in that social activity will really be helpful in managing the emotions and staying engaged with the community. So now we've talked a lot about COPD as the disease, how the person with COPD can manage with both medical treatment and some more non-medical ways that they can manage at home. We've also talked about the family caregiver and the importance of them maintaining their own health and well-being so that they can continue to provide care. So I want to provide you with some resources that really touch on a lot of what I've talked about today. When it comes to managing that caregiver stress and those day-to-day caregiving emotions, caregiverstress.com is a great resource with tips and advice for that family caregiver. I referred a lot to the Mayo Clinic. They have a really great resource online, and I've included that website in there. The National Heart, Lung, and Blood Institute has some great statistical information as it relates to COPD, as does the Center for Disease Control. One surprising, or not so surprising, but one resource that I was surprised that had such a vast amount of resources was the American Lung Association. They have a helpline that individuals can call 24/7, and they also have these better breathing clubs, which are those support groups that I mentioned earlier. So lung.org can be a tremendous resource to those living with COPD and their caregivers. They have a lot of great caregiving tips on there in addition to that helpline and the better breathing clubs. They also have a lot of great videos on breathing techniques. So again, that is a great resource for individuals living with the disease and their caregivers. And then we've talked about how medication management medication is an important part of the treatment, and managing that medication is also very important. So if the individual is having difficulties remembering to take their medication or staying on a regular medication system, simplemeds.com might be a great resource to pass along to the individual and their family. And then sometimes the family caregiver gets stressed, overworked. Maybe they're working a full-time job or even a part-time job and need some extra help at home. There's always in-home care resources such as homeinstead.com that can provide additional information on that. I know we've gone over a lot of information today, and I hope that this will help many of you when you're working with your clients and families who are dealing with a COPD diagnosis. I hope these resources can also be helpful to those that you're working with. So feel free to pass those along to them. So with that, Steve, I'll turn it back over to you for questions. And we do have a guest with us to answer questions. Lanita Kanoki is the healthcare strategist for Home Instead Senior Care and is a registered nurse. She's worked with many patients that have suffered from COPD, so she's another great resource to have with us. So welcome, Lanita.
Thank you.
All right, Steve, do we have any questions from the audience?
Oh, you better believe we have some questions. Of course we have questions. Welcome, Lanita. Thanks for joining us, as Lakeland said. And thanks for a great presentation, Lakeland. It's always a pleasure to have you here each month with us in this series. Everyone, it is time for the Q&A portion, so send in your questions there down at the bottom in the questions box there to Lakeland and Lanita right here. And let's get right to it here, presenters. The first question here, let's see, first question. Okay, are there any exercises or a kind of therapy that you can do to help with COPD?
Well, there are certainly the therapies, the treatment that we discussed on the slide. When it comes to physical activity, we talked a lot about how having COPD can constrict the airways, so it can make it difficult to breathe. So obviously, really intensive aerobics isn't probably going to be the best for an individual with COPD, but types of exercises that are really good are stretching. That can improve flexibility. It can also be used as kind of a warm-up, cool-down exercise. And then aerobic exercise, I'm not saying that it can't be done, but we want to look at more of possibly some lower impact walking, maybe a little bicycling, swimming. Those are some great activities that are a little more low impact that someone with COPD can engage in. And it's best to do those, about a half hour a couple times a week. And especially if the person is engaging in an exercise routine, if they haven't exercised before, you want to build up to that slowly so you don't overwhelm the person and cause them to go or to have an exacerbation or flare up in their lung disease or in their lungs. And then another one is resistance training. So, muscle strength is really good for older adults and everyone's physical health. So resistance training can be good. And for older adults, just a couple pounds can really make a difference in helping them build that muscle strength. So if you have a 2 or 3 pound weight, or even a can of soup, everyone has probably one of those in their pantry. You can use those types of things or resistance bands to increase a person's strength, muscle strength. And then pulmonary rehabilitation, I mentioned that earlier, and that can really teach can be comprised of some good breathing exercises that can help increase the lung capacity. Lenny, did I miss anything else, or did you have anything else to add on that?
No, I would say that all of those, stretching, the cardiovascular or aerobic exercises, any of the strengthening, because the whole idea is to build your energy levels so you can do more activities and increase, so you're less tired and you're less short of breath. And anything that you do that is going to improve your circulation will help your body use your oxygen to the best advantage. And then, of course, reducing your body fat and helping you reach a healthy weight will also help with that. So I think you pretty much hit everything that I would have said. So.
Mm-hmm. Well, thanks for that question.
All right, next question. Does COPD cause the heart to weaken?
It can. Anytime you put any stress on any of your internal organs, it's going to cause another organ to have some more difficulties. So your heart works harder when you have COPD, just like it does. Think of COPD kind of like any other if you had a cardiovascular issue, and how that puts extra stress on your heart. COPD also does that in a lot of the same ways because your lungs work in tangent with your heart. So getting both healthy is your best bet if you've been diagnosed with COPD.
All right. Next question here, presenters. Are there any specific chemical exposures which may cause COPD? I have a family member who is employed at a commercial paint company.
I don't know that I could answer that completely for her, but what I can say is that there are chemical exposures that will cause lung disease and lung damage, and the more damage or disease that you have, the more chance you have of developing COPD over time. So, I mean, even something as simple as dust can eventually trigger a COPD if it's causing you problems. So I think if you're having problems and you're working in some place that's causing, that you're noticing that you're, especially chemicals that have gases to them, you need to be checked frequently, and you need to understand that that is a risk factor.
Yeah, I would agree with Lenita there. Definitely want to consult a physician, especially if they're starting to have any of those symptoms that we went over earlier in the presentation. So those are something that they'll want to keep an eye out for. It might be good to educate your family member on the symptoms just so that they're also aware. And then if that individual can wear any sort of protective mask, especially, I know in my own home, a roller brush versus, using a spraying device to paint the walls can really make a difference on what you're inhaling in. So if they could, depending on, what type of painting goes on or that sort of thing, one of those just masks to help limit the amount of pollution or irritants into the nasal cavity, into the lungs, is going to be better just for his overall general health, or he or she's overall general health down the line. So definitely something to be aware of and to just stay in good communication with the physician about. Great question.
Okay. Next question here. Is a relaxation method like deep breathing exercise not appropriate for a COPD patient?
You could go ahead and do deep breathing exercises. I would probably check with my physician, and if I've done pulmonary rehab, I would check with the rehab specialist also. That deep breathing techniques will still assist you, especially they talk a lot about pursed lip breathing, so it's a matter of how you do it. I've also seen a lot of people with COPD go into yoga that really does help their ability to control their breathing better, which is important with COPD.
And I would add to that. I was going to add on lung.org, that American Lung Association resource that I provided at the end of the presentation. They have kind of a series that's called Steps to Better Breathing with COPD, and it's a video series that really goes through different breathing techniques. So it might be good to take a look at that website. Deep breathing, there's different types of deep breathing that you can do. There's the pursed lips breathing, there's deep belly breathing, so it might be good to just take a look at that in addition to talking to the healthcare professional about whether or not that individual would benefit from those deep breathing techniques. But there is some great information on lung.org that can help or provide examples of different breathing techniques.
All right, great. Next question here. Are emphysema and COPD always terminal and progressive?
COPD is not curable, so it would depend on how you look at that. You can improve your health, but it's a slow progression. So COPD is basically a slow progression of a disease. You can improve your lung function, but you're not going to cure yourself of emphysema or COPD. So it's ways of coping with it, ways of improving your health overall, and then learning how to live within the measures that you need to implement. Obviously, if you smoke, stopping smoking is your first avenue to halt the progression. Hopefully. Lakeland, would you add anything additional?
I would say I agree with that. It's definitely something that's going to progress over time, and we talked about all those different ways to protect the lungs, like Lenita mentioned, stop smoking and reducing the risk of contracting a respiratory infection, because those complications of COPD can also increase the likelihood or increase the risk of, if you develop a respiratory disease or infection or pneumonia, it could, if it escalates, could really create some additional challenges. So it's progressive, and then if we can try to minimize those complications and promote healthy lung practices, then it's not, like Lenita said, it's not going to cure them of the disease, but it can help to manage it and help them still live, have quality of life.
All right, great. Next question, presenters. I work with patients with multiple comorbidities. How does diabetes affect COPD and pulmonary function?
That is a great question. We do see with a lot of chronic conditions that people will have multiple of them. So it's not just, a lot of times you will see those hand in hand. So, Lenita, do you have any thoughts off the top of your head?
That's what I was just sitting here thinking, how would I, it's a really great question. It's really broad. Kind of like I said earlier, everything health-wise in your body affects another piece of your body. So if you have diabetes, that's going to affect everything within and if you have COPD, it's going to affect everything within your body. So improving your pulmonary function and staying healthy and not smoking and doing all those things that we all know that we're supposed to do to stay healthy is going to improve our function no matter whether it's COPD or diabetes. Diabetes can affect, there's certain pieces of diabetes that can affect for example, your circulatory system, which in turn will affect your COPD. And most of our patients, especially in the senior population, are going to have multiple comorbidities. So I think it's looking at a person as a whole and not focusing on just what disease process that you're looking at.
And what I will add to that is when there are multiple comorbidities that a person has, there's oftentimes increased medication that the person is being prescribed. So there could be a case where the person has diabetes or COPD and their physician is prescribing medications for one or the other, and it could, one, interact with medications that they're taking for the other comorbidity or cause some side effects. So it's really important when it comes to that medication management that those physicians or whoever's treating, the diabetes versus the COPD, or even if whether they're the same person or different people, it's important to look at that medication, to be collaborating on those medication lists, to just make sure that there's no adverse drug reactions happening, or that the side effects for one chronic condition aren't going to negatively affect the other chronic condition, or trying to figure out ways to best manage both diseases without the medications causing further issues. So it's definitely something that a physician, a family should be aware of when there are multiple chronic conditions that a person is experiencing. And one important thing is to make sure that that medication is properly managed and that those medications are being reconciled on a regular basis to ensure that all the physicians are in the know of what's being prescribed and to stay on top of that medication list. That was a great question.
All right. Well, we have just about reached the end of our hour here, and unfortunately we are out of time. But I want to thank our presenters, Lakeland and Lenita, for joining us for this Q&A portion for today's session. Thank you so much for being here and for a great presentation.
Thank you so much, Steve. Bye, everyone. Have a great week.
Thank you.